Friends, we are doing left-sided total knee replacement with the Velys robotic system. This is implant used will be attuned PS knee. We are doing tibial first workflow, and then after tibial resection, we will put the sensor tensor. Sensor tensor will say the medial and lateral joint gap inflection and extension. Based on that, we will resect the femoral side rotation and femoral chamfer and anterior cuts will be done. We have mounted the pins. Now we are starting with the hip center, then tibial center, tibial medial plateau, tibial lateral plateau, then right side line, femur center, femur mapping of the medial condyle, femur mapping of the lateral condyle, then femur posterior medial and posterior lateral mapping. After this, we will do the femur tibial line from the center of the tibial center to the medial third of the tibial tubercle. Then comes the femoral anterior cortex mapping. Then comes the validation of all the points what we would have done. We will cross-check all the points of the femoral, whatever points we have taken to validate the distance of the point in this coronal plane. Here we are now ready with the tibial resection. We have taken 0.5 degree varus of the tibia. This is robotic arm assisted saw. We will be holding the trigger. However, saw will resect. However, how much is the planned resection? Then we will come with the sensor tensor and femoral planning, then femoral resection. In this system, whatever plan we do on the monitor, we have to hold the saw in our hand. Saw will continuously do the resection of the distal femur, anterior cut, anterior chamfer, posterior chamfer, in whichever order we would want to have. All this will be completed according to the planning. Then we will be going ahead with the box preparation, patellar preparation, and then trailing of the implants. Once we are ready with this, all the cuts we will be taking from the saw of the robo. Here we are cross-checking with the how much resection we have made. Once it is done, we will do the tibia preparation, trailing, and implantation. Thank you for watching this video.